So I want to talk to you today a little bit about a condition called Trichotillomania, also commonly known as Trich to people who have it. It's a bit of a mouthful if you've never heard of it before. Here at the Wonderful Wig Company, we see lots and lots of people with Trich. Trich is a disorder that affects up to 4% of the UK population. People with Trich repeatedly pull out their own hair or pick at their own skin or participate in other repetitive behaviours that involve damaging their own hair and skin. The people obviously that we predominantly see are the people who pull out their own hair. A lot of people don't understand Trich and they will often simplify the disorder as a habit to pull hair. However, symptoms of Trich can be much more complicated than that. Quite often people with Trich pull or pick hair and skin from other parts of the body too. While some people might just choose one area and pull from that area at all times, others don't discriminate. So they pull from the eyebrows and sometimes even pets and dolls. Lots of people with Trich will have rituals for when they pull their hair, and this can include sniffing the hair, eating the hair, tasting the hair is really common too. There are two main types of Trich. The first is called focus Trich, and people with this condition intentionally pull hair to find the relief from the urge that they have to do this behaviour. The other type of Trich is called automatic trichotillomania, and this compulsion happens when the person doesn't even realise they're doing it. It can be out of stress or boredom, but the causes of Trich are still really unknown. What we do know is that people with anxiety and depression will have a higher risk of developing Trich, and it's considered an impulse control disorder. It very often starts as a teenager, and women are 4 times more likely to develop this condition than men are. Treatment for it depends on the severity of the disorder when it's diagnosed. It can sometimes be managed with behavioural therapy, but Trich is often chronic and long-term, and it has side effects such as social side effects. People with Trich feel like their pulling has to be done at certain times, so that plays havoc with the normal social interactions. Then there's skin damage. This will occur when an affected area is being picked over and over until it's inflamed, and sometimes it can become infected, in which case a dermatologist is often needed. The main side effect we see with this disorder is definitely the emotional stress it causes. People feel shame or embarrassment over it. They often feel like they're the only person in the world with this condition because it's not widely discussed. People with Trich often have low self-esteem and a negative body image due to the hair loss or the skin damage, or they feel people can see the areas of hair loss. We can help people with Trich because we understand it. There's nothing that you can tell us about the condition that we haven't already seen or heard from someone else with Trich. You are not alone. However hard it is to come forward with your condition, we have found a helpful solution for most, whether that's just understanding ear or signposting you to a dermatologist. Depending on the severity of the hair loss, we can advise on solutions to mask the area that you feel is visible. We also specialise in hair integration, which is actually the perfect solution for advanced trichotillomania. If you want to speak with us in private for further advice, please do not hesitate to drop us a line.